Please be advised that the information in this podcast is for educational purposes only and should not be taken as medical advice. Before making a health decision, please consult a practicing medical professional. Thank you for your attention and enjoy today's episode. What is up, cooties and germs of the internet? My name is Tony and you're listening to Hemp Nerd, the podcast that helps you know your cannabis and cannabinoids so you can get reliable therapeutic results. Now, in today's particular episode, we're actually going to do something a bit different from the previous episodes in regards to topic, and we're going to be answering the question, can you take CBD oil with SSRI antidepressants? So we're going to look at this question because I believe there is an underlying concern with people who actually do pose this question. And I personally believe that underlying concern is that whether it is actually safe or not to take CBD oil with SSRI antidepressants. So that's what we're going to be looking at today. Now, as you know, in order for us to do that, the ritual or the tradition around here with the Hemp Nerd podcast is to firstly understand, I guess, the problem. But in today's particular episode, we're going to be understanding what an SSRI antidepressant actually is. So what is an SSRI antidepressant? Well, an SSRI antidepressant, or I'll just call it an SSRI, is a pharmaceutical drug prescribed to patients with depression and or anxiety. The way SSRIs work is that they increase the serotonin levels in your brain by blocking them from being reabsorbed into your nerve cells. The letters SSRI stand for selective serotonin reuptake inhibitor. So serotonin is a chemical messenger or a neurotransmitter that carries signals between your nerve cells or your neurons. The most common antidepressants available in the market, or SSRI antidepressants available in the market, are Celexa, Lexapro, Prozac, Paxil or Pexiva, I think I'm saying that correctly, Zoloft and Vibird. And they all have, I think I'm saying that one correctly as well, Vibird, I'm not sure if I'm saying that correctly or not. However, they have, active ingredients in there that, that actually make the SSRI do the job that it's supposed to be doing. One common one is sertraline, another one is paroxetine, fluoxetine, and I can't pronounce the other two. Is citalopram and X-citalopram, I think that's how you say them, and vilazodone or vilazodone. I'm not sure if I'm pronouncing that correct either, but basically that's all on my blog. So if you actually want to read what these are, you can find them on HempNerd.co under the same title as today's podcast. Now, why is serotonin selected to be made more available in your brain using, obviously, SSRI antidepressants? Well, firstly, you have 7 major chemical messengers or 7 major neurotransmitters that do the majority of the work. They are dopamine, norepinephrine, serotonin, histamine, gamma aminobutyric acid or GABA, glutamate, acetylcholine. Oh yeah, and that's the last one. Acetylcholine is the last one. They all have unique and important functions. However, serotonin is selected because it helps regulate your mood, social behavior, appetite and digestion, sleep, memory, and your sexual function. So the idea behind SSRIs is that it is more the idea is that if there is more serotonin made available in your brain, then it may improve the transmission of messages between nerve cells. Regarding treatment for depression and anxiety, the idea is that the messages that regulate mood and social behavior will have a higher likelihood of transmission. That is why serotonin in an SSRI antidepressant is actually targeted to be made more available, because they believe if there's more serotonin, then there is a higher likelihood of the serotonin being transmitted, especially in regards to managing your mood or regulating your mood. That's the better word there. Now, what's the problem with SSRI antidepressants or SSRIs? Now, on paper, you'd think an SSRI antidepressant would deliver the goods regarding the treatment of depression and anxiety. However, scientists are unsure whether adding SSRIs to your bloodstream actually increases the amount of serotonin in your brain. Plus, multiple patients state that SSRI antidepressants are not a sure fix for depression and or anxiety. And there is no actual way of measuring the amount of serotonin in your brain. And the bigger problem that exists with SSRIs, in my personal opinion, is that they come with a host of unwanted side effects. Now, the list of unwanted side effects include nausea and vomiting, headaches, drowsiness and dizziness, nervousness, agitation and restlessness, insomnia, dry mouth, diarrhea, weight loss or weight gain, and sexual dysfunction in forms of erectile orgasm and arousal dysfunction. Now, it's well known and documented in the medical community that people under the age of 25 tend to experience suicidal thoughts when taking SSRIs. So that's on top of everything else they're going to experience. It's commonly advised that anyone on SSRIs must be watched closely for unusual behavior and worsening depression. It's also known that stopping SSRI medication will result in withdrawal symptoms such as nausea, dizziness, lethargy, flu-like symptoms, and a general feeling of uneasiness. Look, side note, every time I see flu-like symptoms, I mean, at the time of recording this, it's 2020, okay? And of course, one of the big highlights of 2020 has been COVID-19, or the coronavirus of the moment. And, the symptoms there is, everyone knows, flu-like symptoms. So every time I see flu-like symptoms, I'm thinking COVID-19. But then again, I'm also thinking, and this is the same thing that happened in the last episode, is with polymyalgia, one of the symptoms was flu-like symptoms. And I posed the question again, what if here's another scenario. What if you're someone who was on SSRIs and you stopped taking SSRIs because obviously you're in isolation and you started experiencing withdrawal symptoms, and one of those withdrawal symptoms were flu-like symptoms, and then you obviously go try and actually get in front of a doctor, or maybe that's enough to convince you. If you're unaware, there's two scenarios. One is you're unaware that flu-like symptoms could be one of the withdrawal symptoms that you experience, and then you convince yourself that you've got COVID-19 and you should be tested. On the other side of the spectrum, the other scenario is that, maybe you try and go see your pharmacist, or you go try to see a doctor and say, look, I've been withdrawing from SSRIs. Hopefully they're equipped with the knowledge to know that, one of the withdrawal symptoms of SSRIs is flu-like symptoms. But if they're not, then they could presume that you might have COVID-19, so you actually should go through a test. It's just a thought, okay? I'm not sure if this is what's actually going on. I'm not saying this is actually what's going on, but it's just a thought. When I saw, and even when I was doing my research, when I saw that flu-like symptoms was one of the withdrawals. Anyway, let's stick with the topic. Now, this combination of problems, the withdrawal symptoms, anyone under 25 having suicidal thoughts because of SSRIs, and the fact that there's a host of unwanted side effects when you do take them, and also the fact that scientists are unaware that, they're unsure that actually adding SSRIs to your bloodstream increases the amount of serotonin in your brain. So the combination of all these problems, right, is making people turn to cannabis as a possible solution, all right? A possible solution. One overwhelming question people want an answer to is whether you can actually take CBD oil with SSRI antidepressants. And on a side note, the reason they're asking this question, they want to know if it's safe, but the real reason they're asking this question is because they actually want people. There's an overwhelming amount of people that I've seen in so many forums, Facebook groups, Reddit, on Quora, and little forums, little forums here and there, where people are basically trying to get off antidepressants. They're trying to get off their SSRIs, and they're looking to CBD oil as the possible solution to help them do that in the smoothest way possible. So that's why this question is really being posed. So, is it safe to take CBD oil with SSRIs? The main concern, again, in people's mind is whether CBD oil will cause any negative interactions when taken with SSRI antidepressants. The medical community is split as to whether it is safe or not to do so. On one side, you've got anti-cannabis doctors posing the argument that because SSRIs and cannabis both have psychoactive effects, taking them together may cause some unwanted reactions like induced panic attacks, for example. And this is for someone, let's say, with anxiety. So you don't, the argument that anti-cannabis doctors are presenting is that, if you induce a panic attack, you don't know if that's actually coming from the SSRI or the cannabis, if what's actually inducing that panic attack or inducing that anxiety. On the other side, you've got pro-cannabis doctors that's stating that both CBD and THC are safe to take with SSRI antidepressants. The key to success being strategic and careful application, based on what these doctors are saying, the pro-cannabis doctors, which I'm more leaning towards. And by now, I'm sure you can tell I'm pro-cannabis. However, I'm also looking to see what are the most practical, useful ways to actually incorporate this in a way that it can provide, because the whole goal here is to provide reliable therapeutic results with cannabis. And so I'm looking into ways we can actually do that by researching what the pro-cannabis doctors are finding. So the strategy with pro-cannabis doctors point to is something called microdosing. So microdosing is a practice of taking the minimal amount of a given substance, in this case cannabis, to achieve your desired results or effects. With respect to CBD oil, people consume very small amounts throughout the day to achieve results such as reduced anxiety and depression and pain relief effects. Okay, so that's what microdosing is enabling people to do. And due to the doses being as low as 2 to 3 milligrams per serve, which is very low, microdosing enables people to experience the benefits of cannabinoids present in full spectrum CBD products without getting or feeling high. So if you don't know, a full spectrum CBD product is a product that also contains THC. So with microdosing, so what I'm saying there, with microdosing, where the doses can be as low as 2 to 3 milligrams per serve, you can take full spectrum CBD products which do have THC within them and not feel or get high in any way, shape or form. Now, depending on your biochemical makeup, this is something interesting I found. Depending on your biochemical makeup, the average optimum microdosing range is between 3 to 10 milligrams of full spectrum CBD. So it depends on you. It depends on your biochemical makeup. It depends on your body. It depends on what's running within your body at the time as well, what you're doing with your body, your lifestyle choices and everything that contribute to who you are at the moment. But what that range is, that microdosing range where people are finding they can get results without getting high, so to speak, and that's if there is THC present within your cannabis-based product, because there are some that do not have THC at all, and those are called either broad spectrum products, broad spectrum CBD products, or CBD isolate products. But however, if you are looking at a full spectrum product, it's around the 3 to 10 milligram range. Some people less, some people more. However, when you're starting out, which I'm going to get to, it's good to start within the 2 to 3 milligram range and then increase from there over time to see where your happy place is. Now, microdosing is the strategy. However, you still need to be careful with your approach. Okay, so what pro-cannabis doctors generally recommend is to start low and move slow. All right, I'll say that again. They recommend to start low, so that's the 2 to 3 milligram range, and then move slow. Start low and move slow. The moving slow part means increasing your dose slightly every couple of days while paying very close attention to your effects. For example, if you start to feel lethargic or dizzy after a dose increase, then you should reduce your dose slightly and stay at the reduced dosage for a few days before attempting an increase again. So you start low, you increase every couple of days or so, and then when you notice that you're getting undesired effects or undesired results, then you reduce it slightly, see what your effects are. If that's a good place, a happy place, stay there. Don't reduce it any further, for example, and see what effects or what results you're getting, and then increase slightly, depending obviously on what condition you're dealing with. But in this particular episode, we're obviously talking about depression and anxiety, because we're looking at SSRI antidepressants, because that's what they're used for. Now, microdosing a cannabis-based product is highly, highly recommended by pro-cannabis doctors. Like everywhere I go, that's what they recommend. There's not one who has not said no to this. This is because there is scientific and anecdotal evidence that shows that heavy cannabis use can lead to worsening symptoms of depression and anxiety. So, for example, in a 2014 clinical study, researchers set out to investigate the effects of heavy marijuana use in substance abusers versus a control group. The researchers found that the brains of marijuana abusers became less sensitive to dopamine over time. Less sensitivity to dopamine makes you detached and apathetic, which are two symptoms of depression. Dopamine is a chemical messenger or a neurotransmitter that sends signals between your nerve cells relating to reward, pleasure, focus, and pain. In another example, a 2007 rodent model study set out to investigate the effects of cannabis at low and high doses in rats. The study found that THC boosted serotonin levels at low doses. However, at high doses, THC had the opposite effect. Now, can taking CBD oil with SSRIs increase the risk of something called serotonin syndrome? So can it increase your risk of getting serotonin syndrome? Pro-cannabis doctors note that both THC and CBD can obstruct the metabolism of SSRI antidepressants. Obstructing the metabolism of SSRI drugs can lead to an extremely high level of SSRI serum present in your body. The result of this is a condition called serotonin syndrome. This is where there's too much serotonin made available in your system. Having too much serotonin in your system causes unwanted bodily effects such as agitation and confusion, dilated pupils, headaches, nausea and vomiting, diarrhea, rapid heart rate, muscle twitching and tremors, heavy sweating, and changes in blood pressure. Now, according to Dr. Richard Kim, so this is a really interesting quote I found by a medical professional, a pro-cannabis medical professional. He states that the cytochrome P450 or P450 accounts for 70 to 80% of the enzymes involved in drug clearance, making it the most important system for drug metabolism. So cytochrome P450 is at the moment perceived as the most important system for drug metabolism in your body. Both THC and CBD are competitive inhibitors of 3 different enzymes in the cytochrome P450 system, 2 of which are involved in the metabolism of SSRIs. So 2 out of the 3, 2 out of the 3 enzymes that metabolize SSRIs compete with THC and CBD as well. All right, to be metabolized. So if you're taking THC and CBD, this is my understanding so far. If you take THC and CBD with SSRIs, at the same time, which I wouldn't do, I would start with one, then move to the other after some time, then you're inhibiting your system from actually giving it a chance to actually break down SSRIs. This means that CBD and THC are competing for the same receptors, as is the SSRI, which is basically what I said, but he said it more eloquently. So when an SSRI is taken concurrently with CBD and or THC, the SSRI serum concentration could possibly rise since CBD is competing for the same receptors for metabolism, which may lead to serotonin syndrome. I hope that makes sense. So fortunately, Dr. Kim also mentions that if you're concerned about getting serotonin syndrome, it would take an extremely high amount of CBD and or THC to actually produce serotonin syndrome. Yet preventing serotonin syndrome is, in the slightest occurrence possible, is another reason why microdosing is highly recommended. So the way I look at this is microdosing is the strategy, and then being careful is obviously the approach. Another layer of care I would add to this, if you're listening and you're in the situation where you're considering whether you should take CBD oil with antidepressants, is I would start with whatever CBD oil you've decided to go with. I would start with that. I would microdose that before taking if I was taking SSRIs, before taking my SSRI antidepressants. So maybe I'll give a window of about an hour to 2. I think an hour is good enough. Give it about an hour. Allow my enzymes to metabolize the CBD and or the THC, and then once that happens, if I feel the need to take SSRIs, because I haven't been prescribed with them, so I'm not sure if I have to take it as I feel, or I have to take it as a course. But I'm presuming I have to take it as I feel, because if I don't feel the need, why would I take it? If my brain, my hippocampus is helping me manage my mood, but enough serotonin sending messages of mood regulation very well, why would I need to take SSRIs in that case? But let's say the need is there, then I'll give it about an hour, maximum about 2 hours, to then take the SSRIs so they can also metabolize. But if I'm finding that I'm getting results with CBD, whether that's a full spectrum or a broad spectrum CBD solution or product, then I would not. This is my personal opinion, of course. I'm not a doctor. I'm not telling you what to do. But in my personal opinion, I wouldn't even touch the SSRIs if I was getting results with a CBD product. And of course, I'd be consulting with my doctor and letting them know that this is exactly what I'm doing, which is a perfect segue to my final thoughts here. So, based on my research so far, all right, in this topic, I personally believe it is safe to take CBD oil with SSRI antidepressants. Not at the same time, though. Space it out. I would space it out. And I would microdose my CBD because I don't know, like, this is presuming you don't know what your tolerance levels are and your biochemical makeup, but still, I still feel that it's safe regardless. But the smart way is to space out the takes and microdose the CBD. I would, and this is me treading with caution because too much of anything, including something as good as CBD, but we all know this, too much of anything could and may or will have adverse effects or adverse side effects. It goes without saying that you should seek and work with a pro-cannabis doctor. Like, I'm going to stress this, I guess, until the day I die, or until I can't stress it anymore, which would be the day that I die. But I would work with a pro-cannabis doctor. If you don't have one already, I would go looking for one. Because, mixing medications is it's not child's play. It's something to take seriously because you're actually messing with the biochemical makeup of your body. Even when you're just taking regular medication, you're changing the biochemical makeup in your body. Even when you take regular medication, even when you're drinking water, you're having citrus fruits, things are happening in there that we don't understand. And it's best to work with a doctor who actually understands what's going on. So find a pro-cannabis doctor. Secondly, I would actually seek out products. So this is on the product side of things. I would actually seek out products that have been regulated and tested so you can be confident that you are taking a clean and safe product. Remember to start low and slow if you're incorporating cannabis into your SSRI medication regimen. Monitor and document your results with your doctor so you can make the appropriate adjustments where necessary, leaving zero room for guesswork. And the simplest way to do this is to journal. Journal the type or the form of cannabis you're using or CBD oil, your dosage amounts each day, and how often you consume them each day or during the course of the day, and share your results with your doctor. And keep in mind as well that CBD oil is not a one-size-fits-all solution. I know it is the rave at the moment, amongst a few other things, but it's one of the big topics at the moment that everyone is trying to get into, hopefully for the right reasons. But it's not a one-size-fits-all solution. What may work for your friend or a colleague or a family member may not work for you, which is perfectly fine. It's okay because to some level, everyone's different, though we're also all the same. You just need to figure out what is actually going to work for you. So you kind of need to investigate yourself, so to speak. So I hope this podcast was helpful. I hope it was insightful and on a practical level. And look, if there's anything that I missed, anything that I should have mentioned, anything that I should have brought up, please let me know by going to the blog HempNerd.co and check under the comment section of this the blog with the exact same title. Can you take CBD oil with SSRI antidepressants? And let me know if there's anything I missed. I'll be more than happy to look at the thing that I missed and make any necessary updates so we're all on the same page. However, look, if you want any of the references, any of the links, any of the information, this is what I'm trying to say, any of the information that I referenced in today's podcast, all the reference links are available on HempNerd.co. Again, that is HempNerd.co. The blog post title is Can You Take CBD Oil with SSRI Antidepressants? And right at the bottom there, you're going to find all the reference links to all the pieces of information that I had to read and research to come up with today's piece of content. So that is pretty much it for today. Thank you for tuning in to the Hemp Nerd podcast. I truly appreciate it. Take care, stay safe, and I'll catch you on the next episode of the Hemp Nerd podcast. Peace.